Hi everyone, welcome to Center of Balance Live. I'm Szenan-Balance from Center of Balance, the acupuncturist. Now we're gonna talk about miscarriage symptoms or miscarriage signs. I think we missed this part as we carry on. I don't know how I missed this part until I checked my notes and said, "Oh, okay, I forgot about the miscarriage sign." Right, so it's nearly 7:30 in the morning. Today is Friday, and I'm not working on Friday. I'm not seeing patients on Friday. That's my normal day. That I actually don't work on Friday, and I just work half days. Wednesday in the morning and the other days in the afternoon. So our clinic open from Tuesday to Saturday, right? So my colleagues are working and my team's working, seeing patients today, but not me. Okay, I get my time saving and have a rest day for my family and do some workshop and some teaching, and do this live video with you guys. All right, hi, happy day. So if you are on my live video right now, please say hello to me. I Salik and Salik Minika. This is on Instagram, and I know someone on YouTube, but I don't know who you are because you're not saying hi to me. Please say hi to me and give me a thumbs up. And on Facebook and Instagram, please share this live video as well. Thank you very much. I can see that more and more people coming up on Facebook. And please say hello to me and give me a thumbs up and share this video. Please share this video. So our topic today is about miscarriage signs, right? Symptoms, right? As I said, we missed this part. I don't know how it happened, but it happened. Yeah. All right. In the last few days, begin this week, we talk all topics about miscarriage, and we talk about how, what is the risk to have how high is the risk to have another miscarriage, and we talk about what is miscarriage and how it happened, what's the cause of it, and so one of the patients, contact me yesterday. So I have two patients that we discussed about miscarriage yesterday, and I have quite a lot of experience deal with miscarriage patient. Ever since my I've been practicing for 13 years. Yeah, we've been seeing fertility patients for the last 13 years. We help a lot of people with infertility, including miscarriage. Now, so yesterday, one of the patients from Auckland, we live in Hamilton. So from Auckland, they sent me an email, Wiki Tan, right? Wiki Tan. He said, well, thank you for your live video. This is how she said, I bring the email out. He said, hi, Szenan, I am finding your videos very relevant. I'm living in Auckland and I have had 2 miscarriages in the last 7 months. In the last 7 months, she had 2 miscarriages. And the doctor won't refer me to fertility specialists until I have had 3rd. You see, this is crazy, isn't it? It's crazy. The patient had 2, Wiki had 2 miscarriages, and the doctor wouldn't refer her to fertility specialists, and to look out what's going on and what tests does she need to test out. What is the reason that causing her miscarriage? Hi, Tom Sesiong, ni hao. It must be very late in Hong Kong now. You still up? You should go to sleep. Hi, Veronica. How are you? Good morning. We talk about miscarriage sign. Veronica on my live video every morning. Since we changed the morning, it suits you, isn't it? Yeah, I missed out the miscarriage sign. I don't know how it happened, but it happened. So we carry on, and today topic is mainly on miscarriage signs, symptoms. Okay, and I actually have good afternoon there. Okay, cool. Good afternoon. Good morning over here. It's 7:30 in here in New Zealand. So yeah, so Wiki sent me an email and said my live video, because I put it on Facebook, Instagram, as well as YouTube. Okay, and YouTube you can get all my live video in the past, and as well as my vlog, right? Some with acupuncture, some with disease, some for acupressure point, So Wiki had two miscarriage. Veronica in Peru is 2:30, right? It's in Peru, right? Um, so two miscarriages in the last 7 months, and the doctor refused to refer her to fertility specialist to find out the reason. So if you Google it, just about every Google site that will tell you that not until 2 or 3 miscarriage, and they run some tests for you. And I think this is crazy, and that shouldn't happen, because I think it doesn't respect life at all. Even just first, I think the first miscarriage, you need to go and you need to run some tests to find out what's going on, because you want to prevent it if you know what's going on, right? Then what happened? Even though you haven't had any miscarriage, there is some test. That's me. There is some test that we can run to find out what's going on. If you run the test, you know that you have low iron. I would definitely suggest you bring up your iron level before you try to conceive. And this is very important. If you clotting test, clotting test is easy. You just take a blood, give blood and test it. If you find out this is clotting issue, the blood is too thick, then when you're pregnant, and they just need to give you a little bit of drugs, aspirin, and to thin the blood, and then make sure that the blood will go into your uterus to feed the fetus, and that will solve the problem. It can prevent a miscarriage, and that has been proved. You see, and we have been using that method for a long time. And that's with a doctor, and they agree with that, but they don't do it. They don't do it. And when it comes to infertility, when it comes to miscarriage, and we need to have the knowledge, because it's life. You're saving life. If you don't know the reason of causing miscarriage, and if you refer to get the test as a doctor, as a practitioner, you're not helping the patient. You just you're not respect life at all, right? So this is my point. Okay, now this is Vicky, and she said that her doctor won't refer her to fertility specialist until she have had a third miscarriage. That's awful. That's awful, isn't it? Yeah. He said, I'm planning to see a fertility acupuncturist in Auckland here, but in the meantime, I'm trying to gather the tests I need to do, and from your last few videos, I have the following, So she's trying to get blood tests test hormone, great. Now, we're gonna talk about tests, what tests you need to get, but we can talk a little bit because I hope that Vicky can. I'm pretty sure Vicky will watch this video. Then hopefully Vicky can get to the test as well. I've sent Vicky what should she test, and the best way is to see the fertility specialist, because they can run further. They can tell you what test you really need. Okay, but I've sent some tests that we normally ask our patient to do, like test hormones. Okay, test hormones is important, but when do you test hormone? Okay, it's day 2 and day 21, 2 different tests. Day 2, which means your first period, the first day of period called day 1. Day 2, you're gonna test all the blood tests like estrogens, FSH, LH. They'll be accurate on day 2, not on other days. Okay, so this is important. And progesterone is day 21. When we say day 21, that is because 7 days after ovulation, you test that. Okay. Now, then testing the iron level. Iron level you can test at any time. Right? Genetic test. Yeah. Where do I get this done? He said, genetic test. You need to go to fertility specialist. Yeah. Blood clot test. Where do I get this done? Blood clot test. Your GP should be able to do it for you, but some GP didn't want to do it for you. They want to prescribe it, and then they wait for the fertility specialist, and then you have to go to fertility specialist to get the prescription for the test. All right, and yeah, so blood clot test. If you're positive for that, then what happened? It's simple, you can prevent miscarriage again, and blood test for iron. If iron is low, build up your iron level, and that's easy too. If you do those, you may prevent your miscarriage again. Okay, she said, thanks so much for your video. They are so helpful, and I'm so glad I found it on YouTube. That's good. She found me on YouTube. All right. Now, this is the case for Vicky yesterday. So I heard about from Vicky, and another patient that she came to me. Hello, ho ho. That's a very funny name. I like it. Thank you for joining us on Instagram. So I have another patient came in yesterday, and she was here last year. American. So she was here for the first a month of treatment to regulate her period. Then she stopped treatment. She stopped carrying on with treatment. Then she got pregnant after the treatment. Like she stopped right away. She got pregnant, but unfortunately, she had a miscarriage. And the miscarriage, we talk about the sign, right? In this patient, she had no sign. We're going to mention about what's the sign of miscarriage, like heavy period, spotting, bleeding, cramping in the tummy, sore back. She had none of the symptoms. No at all. Okay. Not until she up to week 11, and she went for a scan to check the heartbeat, and there was no heartbeat, right? And then I think in week 8, she ran a blood test to check the HCG. The HCG is a hormone. The HCG didn't actually double. It should double every day. Let's say it was 3,000. The next day you take the blood. You need to continue to do it daily. Normally you just to take 2 or 3 times. They said you won't take it for 7 days, you know. So if you test it today, it's 3,000. Tomorrow we test it again, it should be 6,000. So it should double every day. And that if the first 8 weeks it was 3,000 something, she said, and the next day she did it, it didn't climb a lot. So they suspected a miscarriage. And normally, if you have a miscarriage, the fitter in the uterus, your body should be able to pass it out yourself, but not in this case. Okay, so she didn't have any sign at all, and not until week 11 they had a scan, and the scan showed there's no heartbeat, you know, and they have to do a DNC. Okay, and after DNC, her period mess up, and she get cramp, and of course emotionally, sadness, anxiety, all this thing a lot, happen a lot. Then I did ask her to do all the tests, but again in New Zealand, difficult to get all the tests done. Before she came to see me last year, it was okay. Some of the tests pretty good, but we didn't get the full test. And that's the reason that I keep saying that to my patient. To be honest, I asked my patient to get all the tests done, but difficult. Some patients didn't actually realize that this is important. It's important. And doctor are just giving the hard time. Some doctor is good. They just give the patient what they want. Some doctor refuse to give them all this because the doctor didn't understand it. The GP didn't understand it and didn't know about the fertility things. Yeah, so that's very sad in here. Yeah, what happened is because when you, the citizen in here, when you do all its tests, it's all free. It's all free. You don't have to pay anything. So I don't know the games, the rule in here. Maybe they want to save money. I don't know. I really don't know. So I won't judge them. I just did not understand what's going on, because I asked my GP, and she said, he said, some doctor didn't want to refer, or some doctor didn't want to prescribe the blood test. And I asked him, would you do that? He said, no, I'll definitely do that, because if patient needed, I'll do that. And so you see, it's all dependent on GP, but I don't know every GP's mind, so I couldn't tell. Okay, so you see, I want to tell you the case. Yesterday I met my patient. She didn't have any sign of miscarriage, not until she had a scan and blood test. Then we're gonna talk about the sign. Okay. Happy days. Can the acupressure point you show in your live video about endometriosis reduce it? We talk about reduce the symptoms. What do you mean reduce what? I don't, because my wife has been diagnosed with endometriosis. Okay, now if your wife has been diagnosed with endometriosis, the best thing to do is change the diet. Change the diet to plant-based. That's very, very important, because we find endometriosis symptoms, pain, diarrhea, constipation. When they change the diet to plant-based diet, which is vegan diet, then all those things reduce. As I said before on my live video about endometriosis, no one knows what really going on and what the real reason that form the endometriosis. Okay, and endometriosis is one of the reasons that causing infertility, and it may cause miscarriage too. Okay, so need to be careful about it. So changing diet is first thing, and acupressure point that I show on my live video on the endometriosis, they are very useful for the symptoms. But are you saying that doing those points to get rid of endometriosis? I can't say that. You know, I have no proof of that. But get rid of the symptom, easy. Okay. And what else? Apart from getting off the symptoms, those you need. There's a lot of things that you can do, like control your emotion. She can't get pregnant. Yeah, you're an acupuncturist. You treat her. Using those points that I show you for the acupressure point on the video I talk that you can put needle in, right? You know, you can needle over here. You can needle here. You know, the area that I show you over here, you can needle it. You know, we watch the video and find out the acupressure point, and you can needle it regularly. Okay, 3 times weekly, and you need to check the organs. If there's organ imbalance, then you should do it according to the organs imbalance, right? So let's talk about the miscarriage sign. So to be honest, the miscarriage symptoms are vary, and depending on your stage of pregnancy. In some cases, it happens so quickly that you may not even know you are pregnant before you miscarry. Okay, so what happened is some patients, they, I do believe that sometimes you just like period, you can, oh, this month is so painful, it actually is miscarriage, and you didn't know that. Oh, that's so heavy period this time, and it's so painful cramp, and I never had those pain before. It's just suddenly come, and that may be a miscarriage. But how many people experience that? We don't know, because you can't really tell, and that is miscarriage, because it can be when you before a period or while a period, you just drink some cold thing and it give you pain. And I have patients who told me that whenever before period, bleeding, menstruation, when they drink cold, they eat cold, you get a lot of pain, cramping in the tummy when the bleeding arrive. That happened. Okay, so therefore we couldn't really tell whether this case is really miscarriage, right? That's it. So like I say, sometimes it's just no symptom at all, miscarriage. Okay, now here are some of the symptoms of miscarriage. Heavy spotting. The spotting, spotting is not good, and I want to share with you what are the treatment for miscarriage. Okay, we do a piece of ginger. It's about that thick. It's about that thick. There is $2 New Zealand coin, about that thick, and then get a fork and make hole on it. Make this side hole, and then flex over and make the hole, and put it on 220. No, 220 by whole point. Then you press it on, because here on top you press it on, and you get moxibustion. Moxibustion stick is one of the it's a stick like cigarette, but it's not cigarette. It's Chinese herbs in it. So you burn it and you put it on top, and so with the ginger, make sure that you won't burn the hair, so it's safe. So through the ginger, you can put it quite close to the ginger, and when ginger is warm, and the heat transfer to the point of 220, and this is very good for miscarriage. It can stop the blood, and it can stop the bleeding. Stop the blood, stop the bleeding. Okay, I will tell you, in miscarriage, when you have bleeding, in the Western medicines, they will just asking you go home and have a rest. There is no solution for it. But in Chinese medicine, we have a lot of solution for it. We can take Chinese herbs, but I'll tell you, in the Chinese culture, Chinese people love Chinese herbs to prevent miscarriage. But in the Western world, like I practice in New Zealand, and European or Westerners, they're afraid of Chinese herbs. They're afraid of Chinese herbs. But they say acupuncture is fine, moxibustion is fine. But in the Chinese people, they don't want acupuncture because they heard too much that acupuncture can cause miscarriage. So that is very funny. And they're very cautious about it, about acupuncture. But now, so a lot of people, my students come and ask me, we live in China, Hong Kong, Malaysia, and they ask me, what point do you use to treat, to prevent miscarriage? And I have to offer them, and tell them what way to go, And the best point is in here, by Hui point, 220. So you put the moxibustion in, and the moxibustion go through the ginger and warm the point. And if you have pain in the stomach from the miscarriage and you do this, immediately the pain will subside or even gone. This is how effective it is. This is just one point. The other point is on Guan Yuan and Xue Hai, those points that I showed you before. And you can do Sanin Jiao or moxibustion. And we actually send the moxa stick to patient and ask them to do 2 or 3 days, 2 or 3 times a day. And I tell you, my daughter, she's 11 now, so spotting or bleeding, like it seems like a sign of miscarriage, it may not be at all, because people with pregnant and they may have period, but they're actually pregnant. It's kind of scary, So heavy spotting, vaginal bleeding is a sign of miscarriage. You need to treat this seriously. But on the other hand, I will tell you, some patients actually experience heavy spotting and vaginal bleeding, and it didn't actually cause miscarriage. Okay, but when we see this sign, we treat it seriously, and we do acupuncture needle as well as moxibustion. And if the patient are not worried about Chinese herbs, we give them Chinese herbs. Okay, discharge of tissue or fluid from the vagina. Yeah, if it come out some discharge of fluid, and that's different story, and we really see it as a miscarriage sign, right? Okay, severe abdominal pain or cramping, and it may not be severe. It may be a discomfort in the tummy, and we talk about pain, right? Some people don't feel pain; they feel dragging sensation, something dropping, that heavy sensation, like the uterus or something dropped out of the tummy of the uterus. You have this sensation, and all this sensation and pain, cramping, either severe or just a little bit, is a sign of miscarriage. Again, it may not be miscarriage, okay, but you really treat it seriously, right? Apart from tummy pain in here, you can have lower back pain as well. Now, again, when pregnancy with the lower back pain, a lot of people won't think about this may be miscarriage, but it may. Okay, I won't say that all the back pain will cause is a sign of a definitely miscarriage sign. No, but it may. So again, we treat it seriously. We do all this thing. We get rid of the back pain using acupuncture, but definitely not needle here. We needle this low point, and to help with that. And I also show my patient what the acupressure point for it, so patient can do it at home. Okay, so if you experience spotting, you show that you're pregnant and you experience spotting, vaginal bleeding, discharge of tissue or fluid from your vagina, severe cramping or dragging heavy sensation in your tummy, or pain in your lower back muscle, or severe back pain, then I would suggest you call your doctor right away or your midwife, if you experience any of these symptoms, okay, during your pregnancy, okay. Again, it is also possible to have this symptom without experiencing a miscarriage, but your doctor will want to conduct tests to make sure that everything is fine. So what is a simple test for it? A blood test to check your HCG. If the HCG, you take it for 2 days, just as I just mentioned to you before, if you take the HCG today, it's 3,000, the next day is 6,000, and that's okay. Okay, it's so simple, right? And it will tell you, okay, the baby is safe. But for the back pain and cramping, baby is safe. But for the safe side, if those symptoms get stronger and even bleeding came out and spotting, then you have to monitor that. You keep monitor that. And again, the best thing, go to your doctor is the first thing that I advise you to do, or inform your midwife, the first thing that I advise you to do. Secondly, find an acupuncturist or Chinese herbalist, that can show you the point. And all acupuncture there's two meridian, 220, and you just need to get them to show you that you need to buy the moxibustion stick from them, and you can't find any other way, okay? And use ginger and do on your 220, okay? This is important. But if you suffer from any of this, you're welcome to contact me, all right? And I would be happy to show you how to do this, and there's no harm, all right? And of course, if you can find a local acupuncturist, just go to a local acupuncturist, get some acupuncture done as well, all right? I'm not guaranteed it will save the miscarriage, but I'm pretty sure it will help, all right? You want to do anything that you could to prevent your miscarriage, okay? This is my suggestion. Can one needle to 20 to stop the bleeding? Yeah, we needle it too, but the best thing is moxibustion. Just needle, my experience, not good enough unless you know which direction to needle. If you just needle one needle, now I won't suggest that, okay? Right, this is for today, and thank you for being here with me in this live video. Please share this live video, and I'm an acupuncturist and Chinese herbalist from Szenan-Balance, all right, in Hamilton, New Zealand. Now, please share this video and give me a thumbs up, and leave your comment down there if you have any question at all, okay? I will check it and give you my best answer and advice, all right? The best thing is you get this information. I hope that you can help others and you can help yourself as well, gain more knowledge and information. Thank you, Veronica, and have a good day. Thank you all. Bye-bye. We'll see you tomorrow.